On 26 November 2021, WHO designated the variant B.1.1.529 a variant of concern named Omicron. On the advice of WHO's Group of Virus Evaluation, this decision was based on the evidence presented to the tag B that Omicron has several mutations that may have an impact on how it behaves, for example, how easily it spreads, the severity of illness it causes. Omicron is more transmissible. It can spread from person to person. And it is more powerful than Delta variant also. The number of people testing positive has risen in areas of South Africa affected by this variant. Epidemiologic studies are underway to understand if it because of Omicron or other factors. There may be an increased risk of reinfection with Omicron people who have previously had COVID-19. WHO is working with technical partners to understand the potential impact of this variant on existing countermeasures including vaccines. The PCR tests continue to detect infection, including infection with Omicron. Omicron has been designated as a variant of concern. There are several actions WHO recommends countries to undertake, including enhancing surveillance and sequencing of cases, sharing genome sequences on publicly available databases such as GISAID, reporting initial cases or clusters to WHO, performing field investigations and laboratory assessment to better understand if Omicron has different transmission or disease characteristics or impacts. Japan officially closed its borders for foreign travelers. It has now reported its first case of Omicron variant. Omicron carries a mutation called N51Y, which is thought to allow the virus to bind to human cells more tightly. Omicron virus or B.1.1.529 is a variant of SARS-CoV-2 virus, popularly known as coronavirus or COVID-19. It is the 12th variant of COVID. Omicron variant of coronavirus carries a very high global risk of surges. The WHO warned as many countries are reporting cases. Researchers are racing to determine whether a fast spreading coronavirus variant poses a threat to COVID vaccine's effectiveness. A top priority is to follow the variant more closely as it spreads. It was first identified in Botswana earlier this month and since turned up in a traveler arriving in Hong Kong from South Africa. There is a lot we don't understand about this variant. According to University of KwaZulu et al. In Durban, South Africa. Researchers spotted P.1.1.529 in genome sequences data from Botswana. It reduces vaccine effectiveness because it has so many changes. Pfizer to seek approval for boosters for 16 and 17-year-old. The CDC strengthened its booster recommendations as worries mount over Omicron. Last month's regulatory moves simplified eligibility and formally allowance, a practice already in place in numerous states. Multiple governors had already offered boosters to everyone 18 and older. As on November 29, new cases 80,684. 5,72,000 across the world, which is an increase of 14% in past 14 days, and 7,060 deaths on November 29th, 2021 in the world. Omicron is the 15th alphabet of Greek. But it is also known as South Africa virus. It is a high-risk variant of SARS-CoV-2, and it has taken the world with a storm. The global risk from Omicron variant is very high based on early evidence. It is one of the 5 variants of concern identified by the WHO. While scientists are hunting evidence to better understand this variant, countries should accelerate vaccines as far as possible. Since it emerged in 2019, the COVID-19 virus has mutated several times. Mutations refer to changes in the genetic code of a virus leading to changes in its spike protein. These changes in turn impact the way it interacts with cells. There is no such thing as the Omicron virus. It is still COVID-19 only. It is just another variant or mutation of COVID-19 virus. You can't call Omicron as South Africa virus because COVID-19 can't be called as a China virus. It has been spread around the world on Sunday, with new cases found in Netherlands, Denmark and Australia. The World Health Organization said it was not yet clear whether Omicron first detected in South Africa is more transmissible or not.